As a result of the rising epidemic of obesity, understanding body fat distribution and its clinical implications is critical to timely treatment. The human body stores fat in two main ways, as visceral fat and subcutaneous fat. Subcutaneous fat is the fat that accumulates right under the skin. For example, if you tighten up your abdominal muscles and then pinch some fat from the top of your muscles, that is subcutaneous fat. This fat can accumulate all over your body, including the face, arms, legs, stomach, hips, etc. Visceral fat is just like the name implies, fat found in your visceral section. This fat accumulates around your organs and intestines in your tummy area deep within your body. Why is it not good to have a big visceral fat percentage? Having a big visceral fat percentage in your body can cause a serious interference with the proper functioning of the liver as well as inhibit proper hormonal messaging between the body's vital organs. This can ultimately cause resistance to insulin, which can set the road to developing diabetes, high blood pressure, increased cholesterol, and increase the risk of developing heart disease. Large deposits of visceral fat have been related to various types of cancer like colorectal and breast cancer, stroke, dementia, and Alzheimer's disease. A larger midsection in combination with an increased blood pressure, high triglyceride levels in your blood, low levels of good cholesterol, and increasing blood sugar levels are symptoms of the so-called syndrome X, which appears when the stores of visceral fat are high. How to diagnose the problem? The best way to find out if you have too much visceral fat is to measure it through bioelectrical impedance analysis. You can measure visceral fat in two ways. The first is visceral fat level and the other is visceral fat area. Visceral fat level should be ideally below 10. The normal range of visceral fat area should be below 100 cm square. If it is above this value, then it is to be considered that there is a lot of visceral fat. The gray shade indicates the buffer depending on the age group. If someone in the age of 20 has 127 centimeter square as visceral fat area, then it will be high. However, if someone in the 50s are having the same amount, it will be still considered fine since it is within the gray shade. If someone has high visceral fat as well as high waist to hip ratio, the person is basically having lot of fat in the abdomen. However, there will be certain people who are having low visceral fat area with high waist to hip ratio. For such kind of population, you must check the percent body fat as well. If someone is having a low visceral fat, high waist to hip ratio, and low percent body fat, then the person is having a bigger waist due to high muscle mass. Another example would be having low visceral fat, high waist to hip ratio, but high percent body fat. This kind of people will have certain amount of visceral fat as well, but it will be below 100 centimeter square. This would be the group where they have higher body fat in the subcutaneous area. Research has found that visceral fat is particularly influenced by the cardiovascular exercise. Encouraging your clients to engage in more cardiovascular exercise may improve their health by promoting loss of visceral fat. So, how many of you know how much visceral fat you have in your body?